Okay. Hi, Dr. Kalkanis. Thank you for joining us for this week's
Thank
edition
you.
of Lunchtime with Alums. We're really excited to have you here, class of '89.
Just a couple of years ago, right?
Just a couple of years ago, yeah. And you've accomplished so many things since your time at Country Day. So we are really looking forward to hearing from you and hearing about all of that. And I guess we'll just get started where it all began. So take us back to your time at Country Day. What was it like for you in the upper school? What activities were you involved in? Kind of bring us into your world when you were a student there.
Well, it's pretty amazing because actually some of the key people in my world you all might recognize today because
Yeah.
Mr. Schilling was one of my teachers. Mrs. Hannett taught me for at least a couple of years. Mr. Corwin,
Okay.
so many other legends who were legends back then, and they've continued to be, decades later. Really, I think formed the fabric of the Country Day family. But it was intense. I remember, there's a lot of homework, a lot of studying. A lot of socializing at the same time. Still had all the blue points, gold points, white points, and just loads of activities. But a very meaningful experience. I look back very fondly on my time there for sure.
Okay, so what sports did you play? What types of activities did you do outside of classes?
Soccer and baseball. I was also on the student council. I was one of the editors for the Day Times.
Cool.
So lots of memories looking back and seeing how far and how amazing all of those activities and publications and athletic awards are today. Did Science Olympics as well. So lots of
did you have
similar
a favorite
things to kids today.
Did you have a favorite class or a favorite thing to study when you were there?
Yeah, absolutely. I remember, Mrs. Hannett's English classes were always great. I distinctly remember Mr. Corwin's style in teaching U.S. history. Mr. Morrow at the time was my math teacher and made calculus BC palatable, I should say. So many great teachers, Mrs. Johnson in chemistry and math, and so many great memories.
Yeah, exactly. Okay, so you are a senior at Country Day or a junior, and you're starting to think about where you go to undergrad. So how did you decide where you wanted to go? And then what was your first year in undergrad like? Was there anything unexpected for you or that you were surprised about after having left Country Day?
Yeah, it's a great question. So, the college process is stressful for anyone, and certainly it was stressful back then, and it is today as well. But I can honestly look everybody in the eye and say that there's probably no better school in the country that prepares you both for the process and for college than Country Day. And the college advisors, even then, but certainly now at DCDS, really package and tell the whole story for a student and give everybody a leg up. And I wanted to become a doctor from an early age, so I was pre-med, but really had an interest in political science as well. So was looking at different types of programs. At the time, there was an Iniflex program at the University of Michigan that was a 7-year medical program that I had the opportunity to get into, but decided instead to do a more traditional 4-year college route and went to Boston and was at Harvard for many years for college and med school and residency. But I can tell you that my first year at college, the most surprising thing was how easily writing a paper or studying for an exam came to me. And I don't say that with hubris or anything other than just extreme gratitude for what Country Day provided, because my roommates and my friends at college were absolutely just paralyzed with fear when they had to write a 10-page term paper or this massive project. And that's what we did on a random Tuesday at Country Day. So there was indoctrinated into us great study habits, and nothing was surprising, I should say.
Right, and that is so true. We were very lucky to have that type of preparation. A random Tuesday paper assignment was like a term paper in college. So you're definitely right about that. There one thing that really made you want to become a doctor, or I know you said from an early age you kind of knew you wanted to do that. Was there a catalyst that started that for you?
Yeah, there was. I lost my dad from cancer when I was a teenager, and I think anyone who goes through something like that, it can either push you away from a
Mhm.
profession like medicine or draw you in. And I was
Interesting.
blessed by having lots of great physicians caring for my dad and wondering about the science of it all. And I think I
Mhm.
always liked science and biology in particular, going through middle school and high school, and so I was drawn to it. And then from there, it really is about the power of mentorship and being able
Mhm.
to shadow physicians. And I have such wonderful memories of when I was a senior and the senior project at Country Day, and
Yeah.
being able to, embed myself within a physician practice and hospitals, even from, an early time. To me, that kind of reinforced my early love of medicine. And it also really underscored how important it was to get out and see the real world, but in the setting of a high school experience. It's
Right.
been fantastic.
Okay, so you worked with a doctor as part of your senior project then.
Yes,
Cool.
yes.
And you've also hosted many Country Day students for their
I
senior
have.
projects also. So
Like,
that's cool.
that's a highlight of mine every spring. And I was so sad this year because of everything we're going through that was
Right.
cold, but we'll find ways to
Yes.
continue that.
Absolutely. That's really cool. I think that's so cool for full circle purposes. So you decide to go to Harvard Medical School. What was your medical school experience like? And thinking back on it, for any Country Day students or alumni who are thinking about medical school, what advice would you give to somebody who is about to start out on that journey?
So it's a long road. Number one, you really have to love it. You have to have a passion for medicine. It's not something you can, boom, do a 4-year experience and expect to have everything answered, because it's 4 years of medical school. And then
Mhm.
there's a residency program, which is anywhere from 3 to 6 or 7 years, and then potentially a fellowship after that. And then you
Okay.
start at the bottom of the totem pole all over again as you become a junior attending and faculty member. So it really is something that you have to know deep within you, that you enjoy
Mhm.
helping people, that you love science, you like the discovery aspect of medicine, or even health policy, but ways to contribute to a profession that I think is still the most noble and exciting and innovative aspect of what one can do. But there's so many great options for
Mhm.
people graduating today. For me, going into medical school, people may think that, oh, I want to become an orthopedic surgeon or a neurosurgeon or a primary care
Mhm.
doctor. It's important to have an open mind, because you have the experience in medical school of really having a smorgasbord and going and
Right.
experiencing 20 different specialties for a couple weeks at a time, and really not only understanding how you react to the patients and to the disease, but
Mhm.
the mentors you meet along the way, the people that are drawn to those specialties. Can you see yourself in any of that? And paying attention to that type of feedback and that experience, I think going through medical school really helps people make the best possible choice, because at that point you're really determining what you do for the rest of your life.
And so did you have an inkling that you wanted to specialize in neurosurgery and that area, or was that something that you discovered through that rotational practice?
It definitely is something that happened during the rotations. I guess I love working with my hands. I love the immediacy of a result. So I thought I was more inclined to surgery for sure. But within surgery, there's many different options. And I went to a lecture one day where there was a neurosurgeon who gave what I thought was just a fascinating talk about how the brain is still a black box, and there's so much that we don't yet fully understand. And I just took a little bit of initiative, went up to him and said, hey, I'd like to shadow you. And he said, well, great. I have a case tomorrow, show up at such and such a
Wow.
time. I went and saw, put on some scrubs, totally green right at the time. But it was one of these seminal experiences where there was, and I'll never forget it. It was a young woman in her 20s who had developed a brain tumor near her optic nerve, and she was losing sight, and to the point where she could really only see shadows, and she was
Wow.
totally healthy, and saw this amazing surgery where very delicately under a microscope, this tumor was removed. And he invited me back a couple weeks later in the clinic, and I saw this woman who could now see again. And
Mm.
that just left an indelible mark on me, saying, well, wow,
Wow.
really could make a difference, and let's think about neurosurgery. And so from there, for me, it was, never looking back, but everyone, hopefully, who's interested in medicine will have one of those moments where they get to observe something and really turned on and excited by what they're seeing.
And I love what you're saying too, and this is a theme that I've noticed over the course of speaking with alums through the series that we've done, which is the importance of asking for help and seeking out mentors. And it sounds like just from going up to this doctor in medical school and expressing your interest in this field actually opened up a whole world for you.
And it starts in high school. And I say this to my children and to students who are with me now. Anything meaningful in my life, anything that good that's ever happened professionally has been because of mentorship. You learn so much with people who've gone before from their experience. Sometimes you learn what to do and what not to do sometimes, but at least you have that experience. And so, going to ask for help or whether or not it's going to someone's office hours or asking a few deeper questions about, well, why did you choose this? Or what about this? I mean, this really early on gives I think people direction and a sense of, gosh, let's explore this further because I'm really interested. And that to me has made all the difference.
Yes, absolutely. So you are ready to graduate from medical school and you do that. So can you walk us through your career since the time you graduated? I know there's a lot to talk about, but if you could give us a rundown and then tell us a little bit about this new-ish role that you've taken on at Henry Ford.
Sure, thank you. Well, as I said, each time you succeed at one level, you start at the bottom of the totem pole again. So 4 years of college, lucky enough to get into Harvard, then Harvard Med School. 4 years later, started a residency program, and in neurosurgery, it's 7 years. So I stayed another 7 years in Boston at Mass General, and the fellowship in brain tumors, which was my specialty. And at that point, I had been out of Michigan and in Boston for 15, 16 years. And, my wife and I decided, we're both from Detroit and our families were here. Plus I had a wonderful experience and opportunity at Henry Ford. I came back in 2004, 2005 back to Michigan and started as a neurosurgeon at Henry Ford. And a few years later, I became chair of the department and was chair of neurosurgery for about 7 years. And this past year, right before COVID hit us, actually, I took on the CEO role. And so now I'm the chief executive officer of the Henry Ford Medical Group. And just so honored to lead about 2,000 physicians from around Michigan who are part of the Henry Ford Health System from all specialties. So it's been a big, interesting jump going from my world of neurosurgery to thinking about all of medicine. But the opportunities and challenges are both great and daunting at the same time. But it's I think it's a great time to be in medicine because the innovations and the excitement and the pace of change and the possibilities for finding cures are stunning. And when you think about precision medicine and what we know about the molecular and genetic makeup of disease and people at the same time, there are drugs that are used for diabetes that we now know could be treated, could treat cancer, and who knows what we'll discover with COVID-19 and which old drugs that maybe were used for malaria or something totally different can be used for this. So that's all because of the advancements in science. So to have a role in that and to hopefully encourage young people to say, this is a great time to be alive despite all the challenges for this profession. It still excites me every day.
I'm looking forward to hearing about how you've worked with Ovid during this time, but can you give us a little insight, perhaps pre-COVID, as to what your day-to-day was like as CEO?
Sure. So we have a chairs council, and so I run that, and that's chairs of all 20 of our departments.
Okay.
And what I try and do is build our medical network so that our guidelines and our policies for treating patients are the safest and most up-to-date. I also lead our academic enterprise, so encouraging innovation and ingenuity in our academic productivity, and really trying to put it all together within a complex health system, because we work in hospitals that have their own set of challenges and issues, and trying to really create this sense of an easy button. If you're a patient in the community and you're worried or you have a problem, how can you access an interface with the healthcare system so that you can see a doctor, not just any doctor, but the right doctor, the right specialty at the right time. And I'm a big fan of multidisciplinary care. So I spent a lot of my time coordinating care so that if someone, let's say, has a cancer diagnosis, they're not coming and just seeing a surgeon. They're seeing also a radiation oncologist, a medical oncologist, a clinical trials expert, all at the same time. And so spent a lot of my time as CEO trying to coordinate a lot of this care.
Okay. So I'm sure that your role now has changed because of COVID. So can you tell us a little bit about what that's been like, what your day looks like now, the role you're playing in the broader community effort of COVID?
I checked multiple times. COVID was not in the fine print of my contract. So, but you know, it's I think in many interesting ways, it's brought out the best in our community because people have really come together. I feel like a wartime general. We have a situation room, as it were, and we have an incident command structure where it's myself and leaders of our institution, as well as all of our hospital presidents, our key physician leaders, to really talk about and get a rapid turnaround time for the challenges of the day. Who needs to be tested? How do we get enough masks to people who need it on the front line? What's our message to the community? When this first started, we had to basically stop our entire enterprise, and we didn't do any types of elective surgeries or cases. And that seems understandable at first, except the word elective is a little bit misleading, because if you have heart disease or if you have cancer and are waiting for a biopsy, yes, it's quote elective, but it's still very, very serious. And so you know, transplants don't get to wait because of COVID. So how do you manage that, and how do you get people the care that they need? So these are the types of sort of command decisions we're making. And because Henry Ford is so large in our community, we regularly met with the governor, and still do, and also Mayor Duggan in Detroit, and also with the CDC nationally. And so it became a quick way of sharing best practices and really figuring out what needs we had that maybe other places around the country shared or didn't, so that we could really help them.
Have you found that there have been more similarities with different areas around the country that we've been all able to collaborate, or has there been marked differences where it's difficult to do so?
Well, it's a great question. I think it's been a little bit of both. There have been a lot of similarities in terms of our PPE, our masks, our gowns, and you know, the innovation of using ultraviolet light, or here in Detroit using the auto companies to repurpose their assembly line to make ventilators. I mean, just really wonderful, cool things that we've helped participate in. That was true across all of our health systems, but the nuances of each individual city and population and what their access to care is like, things can be different. One interesting thought is that in Detroit, because our Detroit Metro Airport is an international hub, it's one of the top 5 in the country. And in the weeks leading up to this crisis, a lot of companies in Michigan trade and have business people going back and forth to places like China and Japan and Korea and Italy and so forth, that we think that might be a main reason why there was such a prevalence of COVID here, as opposed to, let's say, Chicago or LA, other large cities. So, we're trying to make the best of it and make sure we have enough resources to care for the people who are sick, and also how do you protect others from not getting infected.
Right, exactly. That's so interesting. Thank you for sharing all that with us. Before we go, I have one more question for you. Sitting where you are today and looking back at your 12th grade Detroit Country Day self, what advice might you give to 12th grade you from where you are now?
Don't think you have to have it all figured out. Just enjoy the experience, because your best days are ahead. And for all people, all seniors right now, and anyone at Country Day, it may not feel like it late at night when you're studying for that test, or the endless homework that's assigned, but it really is a magical time. And everything that you are doing now, all of the hard work that you're putting in, it will absolutely pay off in the years ahead. So trust me on that one, and but find some time to have some fun too. I wish I had a little bit more fun in high school. I guess I would
Yes,
add.
yes. So true. Well, thank you so much, Dr. Kalkanis. We are so appreciative of your time. We're so proud to say that you're a Country Day alum. So thank you so much for everything you're doing also to fight COVID. We're so appreciative as a community. So thank you again. And we hope to talk to you soon, maybe in person.
I would love that. Thank you.
Okay. See you. Thanks again.
Thank you.